Hello, and welcome to the HealthShare plan, a proven alternative to health insurance. My name is Cari Romano. I am a critical care nurse and owner of Concierge Private Nursing, who takes care of patients in New York and New Jersey. My family is also an active user of the HealthShare plan. The HealthShare plan is a non-profit association. Our non-insurance community is centered on a commitment to healthy living and sharing the cost of medical care. We provide high-end healthcare for members and their families at a more affordable cost than traditional conventional health insurance. We are also non-religious based group. We are 100% Affordable Care Act compliant. Cedera Health. Cedera is the engine of the HealthShare plan. They facilitate our medical bills. They're also very patient-centered. There's only a fixed percentage that they receive, 9.9% for their administrative fees. So there's no incentive to ever decline a claim. What we do. The HealthShare plan is designed to be truly different and better. Members share in each other's healthcare needs. Community members assume responsibility for meeting each other's needs, putting the care back in healthcare, and removing the influence of faceless insurance companies. Members have a freedom to choose their own doctor, visit well-regarded medical providers, and typically see that the total cost of healthcare is 30 to 50% less. Our members reduce medical costs through smart choices about diet and exercise and having a healthy lifestyle. And through provider negotiation, our cost-sharing model provides members with high-end services and lowering monthly expenses and out-of-pocket costs. We also welcome individuals, companies, independent contractors, part-time employees, and anyone who is on or has been on a COBRA insurance plan. Another key benefit is that benefits are not tied to an employer. It's portable, so it goes anywhere with you. Growth in sharing. As you can see from the graph, healthcare sharing is rapidly growing as an alternative to health insurance. We have 1.5 million members nationwide using a sharing plan. Your providers are paid more, and they do not need to deal with the hassles of billing a traditional insurance company. It makes them happier and usually will get you bumped up to the front of the line when you need an appointment. Now, how it works. Members pay a fixed amount per month to participate in the sharing network. When an individual has a medical need, and a medical need is described as one or more medical expenses caused by a single accident or illness, the HealthShare community steps in to ensure that it's taken care of. Members first meet an initial unshareable amount, which is up to $500 or $1,000. This will be discussed a little further in the webinar. Then the cost of addressing up to 3 medical needs, 5 needs when a family is participating, are shared amongst the community. Now, just to give you an example, my husband last year had some chest pain, so he picked a cardiologist in New York. We live in New Jersey. He was there for 3 hours. It was a very extensive exam. The bill was over $3,500. We paid $500, which is the IUA that we chose upon enrollment. We received the bill for the remainder of the balance. My husband then had to see his internist to give him the updates on the report that we received from the cardiologist. The internist charged us also about $125 for that visit. We just received a bill for that. We didn't pay anything. The internist recommended that my husband go see a pulmonologist because there was something found on the CAT scan that was done during the cardiology visit. The pulmonologist charged $200. We received a bill for that visit. We did not pay anything. I filled out a 2-page need form. It was very basic. It doesn't require any type of ICD-9 or CPT codes. You just basic name, address, information, and what the reasoning is. So I put, the husband had chest pain. and I faxed it in. Within 30 days, I received a check to pay all of the providers in full, minus the initial $500 that I paid. Consequent differences between the traditional insurance and the HealthShare plan. Traditional insurance, as you well know, you pay a monthly premium, then you get a list of network physicians and hospitals to choose from. If you want to see a physician that is not in the network list, then you have to pay for out-of-network physicians or out-of-network benefits. You then need to pay co-payments, deductibles, and co-insurance, and expect to get balanced bills. With the HealthShare plan, you pay a monthly contribution, which is lower than the typical monthly premium. You choose any physician or hospital. You are free of networks. You pay up to your initial IUA, which is either the $500 or the $1,000, and then you submit a need form for any additional bills. There are some preconditions that are not shareable. They are included in our guidelines. You can also ask me, give me a call or send me an email and ask me about personal questions, and I will be more than happy to answer them for you. Benefits. Enroll any time of the year. Freedom from networks. You choose your physicians and hospitals. It can be in a different state. There are no restrictions. Share while traveling. Share while traveling in the United States and abroad. This is ideal if you are on vacation or on a business trip and have an illness or accident. Pay for your bill at the time of service. Once you're back in the United States, submit the bill with a need form and copy of the paid receipt. You will be reimbursed the amounts minus the IUA. Expert second opinion. Second opinion is required for elective surgeries only at no charge. And you are also given $250 toward your IUA for going through the second opinion process. The second opinion is a telephone medical record review. You can speak with a doctor via phone or video consultation. All the best services without the travel, paperwork, or costs. 24/7 teledoc. Free telephone consultations with knowledgeable, board-certified physicians 24 hours a day, 7 days a week. This is even more ideal for mothers who have young children that in the middle of the night or late at night, they could possibly have an ear infection, they're crying, you don't know what's going on, or they have a rash, and you don't want to drag them to an urgent center or to an emergency room. Give your teledocs a call, and they will speak to you and guide you on what you need to do. Preventative care is reimbursed at 130% of the Medicare rate. And you get a personal medical advisor. We work with members to find the best price on medications or to find the best physicians. Our job is to ensure each member has a wonderful experience and gets the best results possible. Money-saving tools. We offer discounts, services, everything's dedicated to your wellness. Keep the savings in your pocket or put it in a health savings account. Outside of medical cost sharing, members have access to a full suite of innovative healthcare resources. Members also see major savings versus healthcare insurance plans, achieving full peace of mind at a much lower cost. Your rates. Your rates right here, I mean, this chart is very busy, but it's self-explanatory. Just to give you an idea, the president of the HealthShare plan was having a conversation with a woman in the Midwest, and he was going over the plan with her. And she said, well, why would I join the HealthShare plan when my insurance right now, I have a lower premium every month for my family. I only pay $383 for a family of 4. He said, really? He goes, well, what's your deductible? She said, $6,500. He said, is that for the whole family or per individual? And she stated that it was per individual. So each of the 4 had a $6,500 deductible. So he explained to her, what if you had a catastrophe? The 4 of you were in the car together and you got into a car accident. you would be responsible for about $26,000 before any of the medical bills would be picked up. That can do a drastic change in a family's financial, their finances. So you really need to think about it. You have to include what you would be saving in deductibles and co-payments and co-insurances as well when you review our rates. Our members are healthy. If you visit a doctor a few times a year but pay thousands in insurance premiums, you are paying too much for your good health. Our members reduce healthcare costs through smart choices. The choice of using no illegal narcotics, not driving while intoxicated, and tobacco users are required to pay an extra $75 a month.